Hi guys, my name is Thabitso and the name is Khumalo. I'm from Absolute Health Services, work there as an instructor. Today I'm going to be taking you through CPR and the usage of AEDs. So firstly, let's start with the definition. What does CPR stands for? CPR stands for Cardiopulmonary Resuscitation. And what does AED stands for? Automated External Defibrillator. Right, so let us look at quickly. When does one need to perform CPR and use an AED? So mainly in a case of cardiac arrest, where a person's heart stops or starts malfunctioning due to the heart being damaged or there is a blockage. One can even talk about what we regard as AMI, which is acute myocardial infarction, where the heart actually stops as a result of a blood clot. So what does the CPR do? It is a manual mechanism that continues to supply oxygenated blood mainly to the vital organs, specifically the brain and the heart. So during this period, we ensure that there isn't room for possible brain damage, which may eventually lead to, worst case, a person dying. But with the intervention of an AED, that actually increases the chances of survival of the patient by delivering electrical shock to the patient's heart. All right. So let us now look into how to perform CPR. CPR, cardiopulmonary resuscitation, is a combination of compressions and ventilations. So with the compressions, we try to establish continuous blood circulation, and with the ventilations, we are providing oxygen. We continuously do this for at least 2 minutes, repeating the compressions and the ventilations, and afterwards reassessing. So looking deep now, how many compressions do we do? How many ventilations do we do? For how long do we continue to do this? So compressions, we perform 30 compressions and we perform 2 ventilations, and we repeat this for 5 cycles, which is equivalent to 2 minutes. Then afterwards, we will then reassess. But should you have an AED machine, you will then use the machine and you don't have to reassess. The device itself will assess every 2 minutes. Right, so the most important thing here when performing CPR, hand location directly at the center of the chest, using the nipple line as your measurement in terms of location. The ventilations, very important, ensuring an airtight seal, keeping the airway open and closing the nose and mouth. And you ventilate each ventilation to last about a second and take a second in between before you administer the second ventilation. When you compress on the chest, ensure that you compress deep enough at a compression depth of about 5 centimeters, which is about 2 inches for adults and children, which will be slightly different in the case of an infant, where you will compress for a depth of 4 centimeters. It is very important that we try and achieve a high CCF, which is chest compression fraction, trying to reach 100 to 120 compressions per minute. This increases the chances of survival for about at least 10%. When you start performing CPR on a patient whom has suffered cardiac arrest, you are going to check the pulse, the carotid pulse, mainly with adults and children. Well, with infants, you can check the femoral pulse or the brachial pulse. While you are checking the pulse, you also check if the patient is breathing by looking at the rise and fall of the chest for 5 seconds, no longer than 10 seconds. Without a pulse and breathing, you will immediately start with chest compressions for 30 times, followed by 2 ventilations, and you repeat this for 5 cycles. You are then going to request somebody for help whom should call the ambulance and bring an AED machine. So when the AED arrives, you do not stop with your CPR. You continue with the compressions and the ventilations. The person arriving with an AED shall then switch it on and follow the voice prompts, which basically it is to place the pads on a person's bare chest. One pad going on the right hand side below the collarbone, and the other pad going on the left hand side below the left breast. So you have the entry and you've got the exit. So the right hand side pad delivers the shock to the heart, and the left hand side pad allows the shock to leave the system. After the shock has been delivered, which will be instructed by the AED, you will then continue with your CPR. But mainly, the AED increases the chances of survival to the patient by delivering electrical shock to the patient, which will then be followed by performing CPR. So quickly, steps to follow. Arriving on the scene, making sure that the scene is safe, even inquiring from your bystanders what happened. Kneel down next to your patient. You check the responsiveness of your patient. Patient does not respond by tapping on the shoulders and speaking out loud enough. Say, are you okay? Or ma'am, are you okay? No response, somebody help. While you are expecting or waiting for help, you then further go and check the pulse and the breathing for 5 seconds, no longer than 10. No pulse, no breathing. You request somebody to bring an AED and call an ambulance. You will then start with your CPR by performing 30 compressions, followed by 2 ventilations, and you repeat this for 5 cycles. While you are waiting for an AED, whenever the AED arrives, remember not to stop with the CPR, but allowing the second rescuer to switch it on and follow the voice prompts. It is an essential tool to have. Workplaces, public areas, schools, malls, even though it's not regulated by the government, but it is an essential tool to have in your workplace that will save a lot of lives.